Here are 7 blood tests every man must do, especially if you're having problems with erection, ejaculation, you have low desire for sex, or maybe you are addicted to porn, excessive masturbation, prostate problems, or you have some fertility issues, finding it difficult to impregnate a lady. I'll give you the 7 tests, the normal ranges, letting you know when it's high and low, interpretation, and what to do to bring it back to normal. But before that, here are some rules. It's best you work with a good medical lab so that we'll be sure you're getting the correct results. So it's advisable you go to a big medical laboratory or go to a big hospital near you. It's also important to do this test first thing in the morning before you drink anything or eat anything, and make sure there is no sexual intercourse or masturbation before you do this test. This is largely for educational purposes. I am not giving any diagnosis here or any treatment. Total testosterone. The normal range is about 300 to 1000 nanograms per deciliter or 10 to 35 nanomoles per liter. For most men, usually it is low, and usually when it's lower than 300 nanograms per deciliter, you have several symptoms, especially weak erection, erectile dysfunction, sleeping longer and better, strength training and exercises, eating clean and healthy, cutting off alcohol, managing stress can help raise your testosterone and bring it back to normal. Free testosterone. This is different from total testosterone. This shows the testosterone that is actually free to act. This is even more important than your total testosterone. Normal range is usually 5 to 21 nanograms per deciliter or 50 to 210 picograms per mil. Just like the total testosterone, most men experience low free testosterone. So anything less than 5 nanogram per deciliter, again, you experience low desire for sex, you have erectile problems, difficulty burning fat, mood changes, and so on. And similarly, just like total testosterone, fixing your diet and your lifestyle can help improve your free testosterone, even though there's also room for taking testosterone pills and injections. Sex hormone binding globulin, SHBG, binds to the sex hormone. It holds them down, and so they are not available to act. And so you don't want your SHBG to be too high, else it will bind the testosterone and other sex hormones, and you'll be experiencing lower amount of those sex hormones. The normal range is usually 10 to 57 nanomoles per liter, and usually men experience high SHBG, and because of that they have low testosterone, affecting their libido and their erection. And that's why this test is very important. You may have normal testosterone but high SHBG, binding those testosterone and reducing them. Achieving healthy weight and burning fat, increase protein intake like red meat, boiled eggs, then manage your stress levels. Also, taking boron supplement, multivitamin, and multiminerals can help with lowering your SHBG. Follicle stimulating hormone, FSH. This is very important because it eventually helps with the production of testosterone. Normal range is 1.5 to 12.4 international units per liter. As you can guess, a lot of men have low FSH, and because of that, low sperm counts. Fertility problems. What can you do? Adequate sleep, sleep better, sleep longer, manage stress, cut off alcohol consumption and smoking. And there are some pills that can be prescribed by your medical doctor. Luteinizing hormone, LH. This, just like FSH, is also important for production of testosterone and very important for fertility. The normal range for adult male is 1.8 to 8.6 international units per liter. Again, as you would guess, a lot of men have low LH, and so you have low testosterone, reduced sperm production and sperm count, and fertility issues. And sometimes hormone replacement is necessary. Prolactin. This is strange because this hormone helps with production of breast milk, but it is very, very important. One of the most important on this list. If your prolactin is high, and most men are walking around with high prolactin, especially because of excessive masturbation and porn addiction, because of how closely this works with dopamine and how it affects your testosterone and other important male hormones, it will decrease your desire for sex and libido. It will affect your erection. It will affect ejaculation, gynecomastia, man boobs, enlarged breast tissues, and reduce sperm production. You can see how important prolactin is. The normal range is between 2 to 18 nanograms per liter. That's about 45 to 375 milli international unit per liter. First, fix your addictive porn use and excessive masturbation. There are certain drugs that you can take to lower prolactin. I strongly advise you work from your diet and lifestyle changes. As usual, fix your stress levels, sleep better, and avoid nipple stimulation. And sometimes fasting, intermittent fasting, can help bring your prolactin to the normal range. Estradiol, one of the potent forms of estrogen. Estrogen is a primary female hormone. Even though it's important in men, we don't want it too high because it can reduce your amount of testosterone and other important male hormones. The normal range is between 10 to 40 picograms per male. And a lot of men are walking around with high estrogen, and so you see feminine features like enlarged breast tissues, increased body fat, especially around the waistline, decreased libido and desire for sex, erectile problems, ejaculation problems, fertility problems, and mood changes. Again, as you would have noticed, most of these hormones can be normalized by basic things that we have already mentioned on this channel before. Strength training, resistant exercises like push-ups, pull-ups, lifting of weights, eating healthy, reducing alcohol consumption, stop smoking, sleep better and longer, manage stress, fix your addictive porn and masturbation. But most importantly, there are certain products we call phytoestrogen and xenoestrogen, meaning that they are external sources of estrogen that we get either from plastics or from certain foods that will eventually come into our body and increase our estrogen. We don't want that. So avoid exposure to environmental estrogen. They are especially in the use of plastics. So there are certain drugs that your doctor can prescribe to lower your estradiol. Important to mention that there are other tests and parameters you should check, like your blood pressure, your blood sugar, your blood fat. And let me reveal a secret to you. Eating right can fix all of this. And that's why if you click here, I give you 16 foods that can help you normalize these hormones and boost your testosterone, improving your erections, ejaculations, your libido, your prostate health, and your fertility. Click here to watch this video. I'll see you in the next time.